Before we watch Nancy McWilliams demonstrate psychodynamic therapy, I have a few questions that I'd like to ask her about this approach. Nancy, welcome.
Thank you.
Just what is psychodynamic therapy?
It actually is a range of approaches that derive from early work by Sigmund Freud and then his colleagues and then his followers that emphasizes the unconscious source of mental and emotional suffering and the importance of becoming conscious of internal conflict to try to deal with that.
Can you talk some more about the theoretical roots?
Well, Freud was not the first person to discover the unconscious, but he linked it up with a particular kind of suffering that was called hysteria in his time, which now we would more call, I think, post-traumatic phenomena, in which he was very impressed by what they were learning about hypnosis and about unconscious aspects of behavior. And he found that if you encourage, he tried several different things, but if you encouraged people to speak freely about their feelings and thoughts and fantasies, actually it was a patient who taught him that, they would gradually get in contact with less conscious parts of themselves. They would see conflicts that had been unconscious, and they would start being able to solve their problems without developing unfortunate symptoms.
So how would you say this approach is unique among the various therapies?
You know, I think all therapies eventually discover some of the same aspects about human nature, so I'm not sure I can claim total uniqueness for anything about psychoanalysis, but certainly its explicit emphasis on unconscious factors in individuals and going on between two people is a central part of what analysts and psychodynamic therapists think about. And I think in terms of how we work with patients, there's a lot of emphasis on how the past gets reenacted in the present, in the here and now relationship, and that gets kind of deconstructed. And we emphasize also the conflict in people, that they want to get better and that they're afraid to get better. And so they try to get better, but they resist getting better. And we try to help them see the part of themselves that's resisting it and work through that.
Now, are there steps and stages to the work that you do? Kind of a process that you follow?
Only in a very overarching way. I think every therapy is different. I would say one of the strengths of the psychoanalytic tradition has been its attunement to individuality. But in a very general way, the first part of the therapy process involves trying to establish a trusting relationship, a collaborative relationship, one that is asymmetrical, of course, because the client is the one coming for help, but that's mutually collaborative.
Are there unique ways that you would do that in this approach to create that sense of safety, that relationship?
One of the ways would be to keep an eye on what might be in the way of this relationship feeling positive to the patient. Again, a focus on the resisting aspects of the person. If the person's had a bad experience with women, for example, if the mother was, let's say, cruel or negligent, I would be attending very early to demonstrating that there could be a different outcome of a relationship with a woman, with me.
Okay, so you start with this relationship, then what would come next?
And then there's a long or short, depending on the structure of the therapy, period of elaboration of what the client is suffering with an effort to deepen the understanding of that, emotionally as well as intellectually, over a period of time, and seeing how the core problem reenacts itself in various situations, but especially in the therapy relationship. And once there's an agreement between the parties that there's significant progress made, usually people then move toward a termination phase. Although sometimes termination is clear at the beginning if you have a 12-session contract for whatever reason. And there are some patients who I think are essentially lifelong contacts, even though they may not stay in formal therapy. Some people are pretty damaged.
This is a deeper approach in terms of your work. You go deeper inside the individual, and it's a longer-term approach?
Well, you know, it started as a very short-term approach. Like, you know, all the psychotherapies tend to start that way.
Right.
They start with claims that they can help people very fast. And Freud did too. He would call it an analysis if you saw him for 6 weeks. But it lengthened as therapists ran into the complexities of people. And because it's the oldest of the contemporary psychotherapies, it's probably the one that does go on the longest. Depth is a kind of a funny metaphor. You know, what do we mean by that? Emotional power, or making deeply unconscious issues conscious? But I think one of the conceits of the psychoanalytic tradition has been that it's deep, and that we go the distance, and that it often takes a long time.
Now, you mentioned in just a moment ago about the clients doing free association, just talking and talking and talking. Are there other techniques or strategies that you use in this approach?
We're more likely to look at dreams than people in other approaches, although there's some exceptions to that. We're more likely to encourage patients to talk about fantasy, and we're more likely to try to make them feel comfortable with the negative aspects of their reactions to us.
Now, this approach has been around for a long time, the psychodynamic or the psychoanalytical approach. Is there a research base that supports its effectiveness?
Yes. I guess the best recent article trying to put a whole lot of meta-analyses together would be Jonathan Shedler's article about the effectiveness of psychodynamic therapy. Hans Strupp found that earlier. It was implicit in Smith, Glass, and Miller. It's implicit in the Consumer Reports study. I have to say, the current paradigm for research is one that doesn't sit easily with a psychoanalytic approach, because the current paradigm really came from very important work by David Barlow to try to make the point that psychotherapeutic interventions are as effective as psychopharmacological ones. And so it came to be common to set up short-term therapies in which you took data at the beginning, you manualized what you did, you took data at the end, and compare them with drug therapies. And I think that's an interesting kind of work, and there have been a lot of studies that they call horse race studies, where you see, well, is this kind of therapy better than this, better than this?
Right.
Using the symptomatic presentation and the sort of evaluation of that at the end. And I think the unintended consequence of that is to buy into a kind of drug company notion of what psychotherapy is about, that it's about just getting rid of observable symptoms, when so often what people come to us for is a kind of sickness of soul that's very complex. And it's not so much about just getting rid of their temporary anxiety. It's about self-knowledge. It's about the interaction of a substance use problem with their anxiety. It's about the interaction of depression with their anxiety. For me, the research literature that is critically supportive of what I do is not necessarily the horse race studies, which tend to come out with what they've called the dodo bird verdict, that all therapies work and all should get prizes. And probably the way they work has much more to do with relationship factors and personality factors than with so-called techniques. But the research on affect, on attachment, on neuroscience, on personality, on defense mechanisms, and we have 30, 40 years of research on that stuff, are very valuable to me and very consistent with my psychoanalytic metaphors and theories.
So it sounds like some of the more recent ways of researching psychotherapy is to simplify the process, and your approach leaves the complex process complex.
Yes, I think that's a really good summary.
Yeah. Now, in a moment, we're going to watch you work with an actual client. And what are you going to look for in the interview? What's going to be important?
I will be trying to feel my way into what kind of relationship starts to develop between me and the person. I'll be attending to not only what they're saying, I'll certainly want to feel what it is they're suffering with that brought them. But I'll want to experience how they're relating to me, not just verbally, but with their facial affect, with their body language, and what gets stirred up in me in response. In other words, their transference to me and my countertransference to them. So I'll be paying attention to subtleties, including a lot of attention to my own internal process, what thoughts are starting to go through my mind, what songs start to go through my mind, what feelings, what body sensations I'm sensing with them. I won't say much about this usually, certainly at the very beginning, but that's how I'm experiencing
the relationship
it.
and monitoring yourself.
Yeah.
Now, are you going to pay attention to the history, the story, the presenting problem, the client's thoughts, their feelings, their behavior?
All of that.
Yeah.
It's kind of a myth that psychoanalysts take a huge amount of attention to just rehashing the client's history. But it is true that the history is very important to us to understand, and to understand with the client, because if the client doesn't understand the reasons that they developed a particular self-defeating pattern or type of suffering, what they're going to do is blame themselves or blame other people, and that's not going to get them anywhere. If they can start seeing that the way that they behave makes sense based on what their situation was as a young person, they can start forgiving themselves, not being so shamed, and in their prefrontal cortex, distinguishing between then and now. So we do spend some time trying to mine history, but we pay a lot of attention to that early so that we can make a formulation in our mind about this patient's troubles. And we also monitor it when we feel the history coming into the here and now relationship. When I feel a client behaving toward me a certain way, I'll start thinking, what in the person's history makes sense of the fact that they're suddenly wary of me or ingratiating toward me or hostile toward me or whatever I'm feeling? How do I understand that in the context of the person's life? Also, I'll be asking, have I done anything to make them wary or hostile or whatever they're feeling toward me?
Now, just like clients have these mistakes they make or these self-destructive ways of dealing with life, what do you want to make sure you don't do in your interview?
That's a good question. I don't want to foreclose exploration. I don't want to close down something. I don't want to assume that I know what the patient means when the patient says something. I want to help the patient continue to elaborate their experience, their story. They may have had an experience that I think is very much like an experience of mine. But I'll try to hear whether they may have experienced that differently. So I try very hard not to cover something over, close something up, collude with the part of themselves that doesn't want to go to a place that's really painful.
Right, okay. So you try to be with the person rather than put a label on what's going on, or to try to categorize it and
Yeah,
understand it in their terms.
and I guess I try to pay attention to my own narcissism, because patients often tell you how much you're helping them,
And that can be hard to...
and a part of you wants to say, yeah, I'm great,
Good observation.
rather than to say, well, what about the part of you that doesn't feel helped? Or do you have any negative feelings coexisting with these grateful ones?
Right. So what makes a good patient or client for your type of therapy?
Somebody who's curious about themselves, who's not too concrete. You know, some people really want a program, and that's not the strength of the psychoanalytic method. Although, you know, if you understand a person well enough, you can adapt to that need. But somebody who is curious, motivated to understand themselves, not afraid of attachment, or able to tolerate their fear of attachment and closeness, because a psychoanalytic therapist is going to get to see, if the process goes right, the ugly parts of the self, the needy parts of the self, the parts of the self that the person has a lot of shame about.
As a kind of a final question that might pull all of our interview together, what are the ingredients of effective therapy? I mean, what's going to make this work when you see clients?
Well, all the research literature, I mean, as it's been summarized by people like Bruce Wampold or Sidney Blatt, Stanley Messer, many other people actually, seems to suggest the conclusion that what's therapeutic is not a particular technique. The relationship is what's therapeutic. The person gets a different experience. They come in, they expect an old story, and somehow a good therapist makes that story come out differently from the way they thought it had to come out. And I think you can do that from any theoretical perspective, and I've always been impressed with the empirical literature showing that experienced therapists have much more in common than experienced therapists have with novices in their own orientation. So I think we learn over time to give ourselves over to a process that's kind of organic, and trust that it's going to go someplace. If we watch it and try to get in the way of it reenacting point for point all the bad stuff in the person's history, we can make it come out differently. We'll be a partner in this project.
Well, thank you so much for your comments, and let's move on now to see psychodynamic therapy in action.
Okay. Okay, Chi-Chi, we're back after a couple of hours. Catch me up on what you found yourself thinking and feeling after the session.
I was really just trying to process it emotionally and try to think about what parts of my past would fit into what's happening now, and I was trying to pinpoint, you know, which of those things would be the most significant, which of those things would maybe not matter as much, and just kind of trying to process it that way. I'm not saying that I came to any conclusions, but it was just a matter of trying to do that with it.
What stands out for you among the many things you talked about?
I think that you had some really interesting insights, things I hadn't thought about in those terms when you talked about the all the incidents of abandonment, of impermanence, those kinds of things. I guess I never really thought about things in those terms. And so it was interesting that that was how you saw
Yeah.
it, and also your idea that I always seem to get to a certain point with something, and then either pull back or do something deliberately to make it stop working or being good or whatever. And I thought, again, that was something I had never really thought of it in those terms. I had always thought of it as, well, no, I didn't. That's just a goal that I never reached, that I never even really came close to. In other words, almost like it was doomed from the start. It was a failure from the start. So I was thinking, well, maybe there is another way to look at all this and to view all this that is easier to deal with and makes more sense. I don't know.
Uh-huh.
I don't know. I mean, again, these were just things that were going through my head. It wasn't like I was coming to any deep, brilliant insight or anything like that. So,
Well, one of the things I've really been struck with over time working with people is that we all assume that our own family, our own history is sort of normal.
right.
And for an outsider to say, no kid should be moved as much as you were to all those different environments and then attacked when she was difficult
Right.
because she was reacting to all that. It can come as a complete surprise because although it would be obvious to anybody looking at from the outside,
Yeah.
it's just your life.
Yeah. To me, it was my life, and there wasn't anything that I would view as sort of really real traumas, like we didn't have a death of a close of a sibling or a parent. We didn't have divorce. We didn't have those kind of things.
No sexual abuse.
No sexual abuse.
Horrible accidents.
Yeah, exactly. The things that you normally think of as being really, really traumatic, terrible things happening in a family. We didn't have that. So I guess, to me, I never put it in those terms of being something that could be upsetting and traumatic.
Yeah, if you ever get a chance to get to know a young child really well and you watch them respond to separation, especially the first few times they have a major separation like a move or going off to school or nursery school, it's very difficult for them. There are a lot of emotions involved, and how well they do with it depends a lot on the compassion of people who are helping them name their feelings.
Yeah.
And that's what I think you missed. It wasn't even so much the moves themselves, although they were too many and too disorienting, I think. But I don't get the sense that anybody talked with you about how you felt about them. It was just what your family did.
Yeah. Not really. I mean, there was a few years ago. My mother asked me. She said, sometimes I wonder if it was really the right thing to do to move you guys around so much when you were little.
It hadn't occurred to her until then. That might have been a problem.
And it was, we had never had that conversation growing up. It was always just, well, this is what we're doing and this is where we're going. And, and when she said that, I said, well, I said, I think that there were good things and bad things about it.
So you comforted her in her guilt.
Right.
She probably really had no choice about the moving, given your father's job, or at least some of the moves were probably out of her control.
Some of them were out of her control. When we were older, she went back to work and actually worked with my father, and so she did a lot of traveling herself. She did like all the traveling and all the moving and going different places. She really did like that. She said that was one of the reasons that she wanted to marry my father because she knew that was the life that he had. I don't know if she realized how difficult it could be.
I doubt it. I think it would have been too painful to her to realize that.
Right. So I think, but it's interesting what you were saying because it reminded me of when I was in school, in high school. I was in high school overseas, and a large number of my classmates were British, and I remember that how so many of them told me that it was the normal done thing to do for parents to send their kids away to school at a really
Very young age, yes.
6 or 7 or 8,
Yeah.
really young. And almost every one of them said that they felt like they could never forgive their parents for having done it, that it was so, that they felt so emotionally devastated by it.
Yeah.
And I remember being really surprised to hear that because it was such a common thing. But
Yes.
they almost all had that same reaction. And they all
Yes.
said, I will never do that to my children. I thought that was interesting.
Yes.
But again, I think that parents don't think about that, or maybe they feel they have no choice. I don't know.
Well, I hear in your saying that a wish to exonerate your own parents, who you love, and who were probably doing the best they can.
Right.
But some parents do think about that, and you know, some mothers wouldn't want to marry a man who would be traveling all the time when they were taking care of very young children.
Right.
So, in a way, I think you're trying to protect yourself from the grief and the anger that someone should have known how hard it was on you. Although, I mean, from what I understand, the hardest thing is not necessarily the losses of the moves themselves, but two other things. One is how people dealt with it, whether you felt your feelings were expected, accepted, understandable, supported. And the other is what sense you made of it as a young child. And since young children they're egocentric, not in a bad way, but whatever happens to them, they develop sort of self-referential explanations of it. Like, you know, my father died because he didn't love me enough to hang around. You know, depending on how old the child is, they will develop these self-referential explanations. And I'm guessing that especially without people helping you with your feelings, you developed some sense that you were being punished because there was something wrong with you. Because once again, they're ripping you out from under your familiar surroundings, your friends, in some cases the availability of your father. And I'm thinking that has probably more to do with the problem that we want to keep our eye on, namely, why do you sabotage yourself when you start getting toward a goal? It's very hard to actually make contact with that part of the self that might feel like it's because I'm bad that these things happen to me and I don't deserve anything better. And I'm only guessing that that's what's there. But I wouldn't be at all surprised if that's underneath.
Right. Yeah, I don't recall having those feelings when I was little about those upheavals and those. I mean, we didn't really talk about it. Like I said, it wasn't ever discussed. It wasn't ever, you know, presented as, you know, well, we know this is going to be difficult, but it was always just, well, this is what we're doing. You know. Deal with it.
Yes.
And I think, you know, the other kids that I made friends with, grew up with, were in similar situations. So we were all, it was almost like it was normal, you know. So I think people who grow up in the Army, it's probably the same thing.
Yes, I was thinking about military kids. I've
It's probably the same.
run into similar stuff.
Mm-hmm.
And it's the same, it's usually the same attitude on the parents' part. This is just what military families do, so, you know, tough upper lip and
Right.
don't be a baby.
Right, right, right. It was, yeah, that was very much the way it was done. I think really the where it all sort of came to a head was when probably once I became as into the teenage years, 12, 13, that was when I really started acting out.
Sure.
At which, yeah, that's the age that most people do.
Well, not only
And-
that, but it's at that age that the peer group is so critical, and
True.
moving is traumatic at that age. It's horrible to be a new girl at that age. Whew.
Yeah. Yes, yes, yes. So that was, yeah, that was, although at that point, when we made that move, I actually was looking forward to it because we were living in the States and I was very unhappy here. So I was actually looking forward to going somewhere else.
It must have been kind of odd for you to try to adapt to a United States adolescent population that didn't have your background.
Very, very difficult. Very difficult. Almost impossible.
Yeah.
So it was, yeah. So at that time, I was actually looking forward to moving, and I was very happy with that move. But it was also, again, I think because I was an adolescent, and that was when I really started to, in a sense, start to break away from my family. But my tendency was to do it in a very dramatic fashion. So, and that was, I would say, really when things really got just constantly confrontational and just for
Yeah.
years. It
I
was
bet
like-
they didn't know how to deal. This is a
They
diplomat's
didn't.
family, right?
Right.
How do you deal with an angry, acting out,
Right.
promiscuous,
Yeah. Yes.
substance-using adolescent?
Yeah. It was
Not in the manual.
not in the manual at all. No, and not at all what what I had been. It wasn't like I came from a they weren't substance abusers. It wasn't, So, but that was. So I think that was when it really became just a really untenable situation in a lot of ways. So,
Well, let me change the topic a little bit and go to where I felt that you had the most emotion when I watched the original tape of you with John Carlson. And that was around the loss of that relationship. Are you willing to talk about that and what that meant to you? I think that's connected with this instability.
For some reason, it's really hard for me to talk about that one. I can talk about all the rest. I can talk about the one I'm in now. I can talk about all the ones in the past, all my past disasters. But that one, I think the reason that one is so hard for me to talk about is because I really do think that was one where I really did.
Were you sabotaged it?
Yes, where I really just completely ruined it, and I don't think people should. I don't think it's healthy or good to constantly have a regret about something like that. I think you have to be
able to move on. And I think I have. It's just that it's
Well, what comes through is not just regret, but shame. That you, at least that's what I'm feeling from you, that
Yeah.
you acted in a way that you feel mortified by in retrospect.
I do. I feel mortified by it because I feel like it was completely in my hands, and it was completely within my grasp to have made that work. And for some reason, I didn't, and I deliberately destroyed it. And
Are you willing to tell me what you did? I think one of the ways to combat shame is to actually say what's so shameful and see if there's another way to think about it.
I don't. I.
If it's too much, you don't have to go there.
No, it wasn't. It wasn't something I did that I'm ashamed of so much as. Well, I guess part of it is. I allowed. I feel like I allowed too many outside influences to make a decision for me that was not in my best interest. And I guess what I feel ashamed about is that I did that, is that I was a grown person and I didn't act on my own, in my own best interest. And that's what, when I look back, that's my regret. That's that I have no one to blame but myself. And that's the part that, is. And maybe I've idealized this relationship in my head too, but I don't think so. I don't know.
Well, I can see you struggling not to get into too many details. If I were in a long-term therapy with you, I would slowly try to get you to tell me all the details. But here's what I am putting together from what you've said so far. That growing up, all kinds of decisions were made for you by other people.
Right.
You had no say in it. You just had to cope. You had no opportunities to develop your own sense of agency, of having control over your own life. And when you hit your teenage years, you determined to live your own life with a vengeance
Right.
in a way that was self-destructive, but at least it was your self-destructiveness. You were in charge of it.
Right.
And so I find myself not surprised that, A, you let other people influence you a lot, because I think there was a disturbance of your sense of agency. And in a way, it's a repetition of, listen, everybody else knows where you should be.
Right.
You should leave the guy. Or
Right.
we're moving.
Right.
And the only way you could feel your own sense of agency in that situation was to precipitate exactly what the loss was that you were afraid of. It's like a kind of acting out.
Right. Right.
But at least you did it. I mean, in some ways, I think one of the consequences of your history is that you can feel your power mostly in opposition to someone else's agenda.
Yeah.
And when you're headed toward the finish line in whatever it is, and you start feeling that some other agenda is now controlling you, you may need to throw a monkey wrench into everything. That's how I'm putting these
That's
things
interesting.
together.
That's interesting. Yeah, that's. Yeah, I think that's. I think that's what it is, and I think, but. I don't know, because what am I opposing now? You know what?
Yeah,
You know.
well, the unconscious isn't so rational.
Well, then, okay.
We do find ourselves, and that's really what you came in for. That you keep enacting something that doesn't make sense, and you're saying to yourself now, why doesn't it make sense? But in a way, it made perfect sense in your family of origin. That really was the only way that you could feel like you were living your own life.
But why couldn't I have done that in a way that was more constructive than destructive?
Well, you would have needed some help from the adults in your life to give you a slowly developing sense of agency, including maybe things like saying to you, we do have to move, but let's figure out what would be best for you given that we have to make this move. I mean, I think your mother with 3 kids probably couldn't sit down with each one and do that.
Right, right.
But some parents will very carefully do that. I know you're miserable about moving, but at least let's talk about how you want us to paint your room.
Right.
Whether you want to go to the public or the private school,
Right.
let's think about those things. I mean, that's how you help a kid get a sense of agency.
True.
And I don't hear that they did that. I hear that your father's job kind of dwarfed those ordinary family processes.
Yeah. They did let us pick what schools we wanted to go to.
Okay.
So that was, and that was kind of fun, and that was kind of, so that was that way we were a part of the process. But yeah, I guess, yeah.
Let me, I see you sort of struggling to make it fit. I may be completely wrong.
No, I don't know.
I'm throwing it out because
I know.
maybe it will really strike a chord in you and it will help you make sense of this, and there will be a sense that you can make of it that doesn't involve this self-critical,
Right.
I'm just an idiot
Right.
reaction that has been your favored way of dealing with it.
Yeah, and I mean, I try to think of things that are, you know, where I have been successful or where I have been, where I haven't seen that pattern play itself out. And I guess it's hard for me to say, it's almost like it's hard for me to connect those areas with the other ones, you know. And it's hard for me to have complete trust even that those things are really as good as they seem, or even as...
Tell me about some of those. What are the things that you haven't had trouble taking to their completion or being successful in?
I think that my friendships, I've been successful at having close friendships with a few people, and being able to have then a wider circle of people I wouldn't call friends, but acquaintances, people that provide a certain level of support and other positive things of my current relationship, I would say.
has been successful, and I so I sometimes think, gee, I wonder why I didn't manage to screw this one up yet.
Yeah.
You know, and I want to stop thinking that way because that's not a good thought to have in the back of your head. And you know, work is a mixed bag. In some areas, I've done very well; others, not so much. But you know,
What do you think makes the areas of success different from the others? I mean, obviously you're anxious that they'll also go the way of the others, but does one involve men more, or does one involve, you mentioned weight, attractiveness, that could be related to men. Is there,
yeah. I mean, that's certainly. I'm certainly unhappy with my appearance because of my weight. And that's a big deal to me because that was always something that that was always something I felt really good about when I was younger. You know, I always felt really proud of my appearance, and now I don't. So that feels like a big loss too. And
no wonder you understood my feelings when I was upset with the makeup,
makeup.
this morning.
That's right.
I felt this immediate compassion for me.
Oh, I know how awful it feels when you feel you don't
Yeah.
look good. And so, you know, and again, that's something that is up to me, and it's in my, I mean, certain things I can't fight, like time, but there are aspects of it that I can control, and that's a big one, and I'm not able to do that. And supposedly it's important to me, and I can't do that. So why, you know, why is that? You know, at work, I mean, I'm in a good position now at work, but my work life has been rather checkered, and you know, again, I would, you know, that's also something that's important to me, that gives me a lot of validation. And again, in the past, I found myself in situations where I was in a good job, and something would happen, and I would either quit or get fired. And you know, again, this is supposed to be something that's important to me, so why do I keep not making it work?
And would you get fired because you had done something provocative or lashed out? We haven't talked about your anger too much, but you did mention anger in the...
that it would usually be related to something like that. Personality clash. You know, not knowing how to handle conflicts at work or problems at work, that kind of thing. It's like this little busy black cloud that keeps chasing me around.
Yeah, right. I imagine when you were a teenager and when you were screwing up your life in certain ways, you probably had the same sort of voice in yourself going, why are you doing this?
Yes.
What's the, why can't you just
Right.
Not throw your life away like this?
Right. Yes, I did. But it just seemed like it was so important to just be defiant and to defy everything, and to
Well, I think you were angry, and I don't think there had been much room for normal anger in your family.
No, there wasn't. There wasn't. There wasn't. So I think I don't know. But now it's like I've worn all that out, and now what's left? So.
Well, let me make a recommendation and a prediction. The recommendation is, as I said earlier to you, I really think it will be valuable to you to have real therapy over the long term with somebody who could be there for as long as you want the person to be there. The prediction is that in a therapy like that, these patterns appear in the here and now. They're not going to appear between you and me in 2 hours, but you will probably find yourself feeling angry and oppositional toward the therapist and the therapy process at a certain point. And it's critical that you hang in there and understand that at that point, rather than enact the same thing that you've done with other stuff. And that'll be the responsibility of both you and your therapist to try to make it come out differently this time.
Right.
Because one of the things that happens in therapy is that there is a subtle repetition of the serious emotional things from your life, and they can just replay unless you both parties are attuned to making it come out differently this time around.
So in therapy, the idea is for it to come out with a different ending.
Exactly.
This replaying.
Right. You can't expect yourself not to find yourself feeling angry or hopeless or fearful that you're going to lose the relationship or the rug's going to be pulled out from under you. I think that stuff will come up a lot. But I'm urging you to hang in, because I think with a different ending, you could be re-educating the internal tapes.
Right.
I mean, you wonder why you do these things. We've learned over the past 20 years a lot about the brain, and the amygdala, it takes a long, it never completely unlearns something. It just, it learns other stuff that modify what it has originally put down. And that's what happens in therapy, basically. Emotional learning is permanent as far as we know, but what we can do to take it in a different direction is still really considerable.
Okay. So there's hope.
Yeah, absolutely. But it would really require an investment.
Right.
You know, it's not going to be something you'll get from a one-shot thing.
Right.
We only have about 10 minutes left, but let me ask you something I haven't asked yet, and that's whether you dream.
Yes, frequently.
And do you have recurrent dreams? Are there themes in your dreams?
There are recurrent dreams and themes.
How would you describe your dream life?
It's mostly actually very pleasant. I usually like my dreams a lot. Usually they usually involve outdoor settings. Usually water, oceans, beaches. People that I know.
You know, the first thing that came through my mind when you said water and ocean and beaches are things that don't change much.
Oh,
You know?
interesting.
Natural, not that that's entirely
Well,
true.
yeah,
But it's not like
yeah.
moving from country to country.
Oh, well, yeah, that's true. Yeah, I rarely have bad dreams. They usually are, like I said, there's usually people that I know, people that I care about in them. They're usually in these beautiful settings. I sometimes think, I want to go back there. You know?
Yes.
Uh,
I bet you felt that a lot as a kid.
I did.
want to go back there.
Yeah. But, so that, yeah, that's,
You haven't had recurrent nightmares or any?
I did when I was younger. I did when I was younger. I did, but that stopped when I became an adult. Um, the the bad dreams I have now are I have dreams about I would qualify them as nightmares. They're dreams about people dying.
About loss.
Hmm.
Have you had people die on you?
My father.
That's right, 10 years ago.
Yeah. And it's more than that now. Yeah, about 10 years ago. And yeah. So
And what did he die of?
he had a stroke, and then he had a heart attack about a year later. The stroke really put him out of commission, and then he had the heart attack.
That must have been hard to see him that way because
It was terrible. It was terrible. Yeah. It was completely unexpected. He was very healthy, and but after he had the stroke, he didn't want to take care of himself. He didn't want to do the things you're supposed to do, or do his physical therapy or any of that. He kind of just gave up. And so yeah, it was tough. So
And did you grieve that?
yeah, yeah.
Did your family, were they able to grieve together?
Yes, we were, actually, and I gave the eulogy at his funeral, and it was, yeah, and a lot of other family members came for the funeral and spent time with my mother and with us. So, so yeah, we were able to. My mother had a really hard time with it.
I bet.
She took a very long time to.
I imagine
Yeah,
because
yes.
her whole life was an adaptation to
Yeah.
his life.
Hmm. And they'd been together so long,
Yeah.
and so it was really hard for her.
And you worry about her, you said, how is she doing?
You know, she's her. It's her. I worry about her physical health. I worry
Yeah.
about. It's funny. I was talking about it with a friend of mine whose mother has Alzheimer's, and she was telling me. She said, "Well, believe it or not, I envy you because my mother has perfect physical health, but she doesn't even know who I am."
Yeah.
She said, "At least you can still talk to her.
Yeah.
You can still, you know, she's still your mother." And it was interesting because it made me realize that, you know, that I am fortunate in that sense that.
More fortunate would
More,
be
yeah,
not
okay.
having a sick mother.
Yeah.
I think that's one of those little voices where you're telling yourself, it could be a lot worse. Why are you feeling so
Well,
bad about
that's
this?"
true.
You
That's
know?
true.
And other people are happily recruited into that role
Well,
of
that's
telling you
true.
that
That's
sometimes.
true. Yeah, that's
But
true.
you've lost your father and your
Yeah.
mother's in a worrisome condition.
She is, and she is. And again, it's a condition that she won't take care of herself.
Oh my.
You know, she knows what she needs to do to improve her health, and she
doesn't.
do it. And it's unusual for me to see that because that is not her personality.
Yeah.
Um,
So she's given up too.
she's
in a
kind of
way.
given up. She's kind of given up. Yeah.
Huh.
And I think that's the part that's really hard for me to watch.
Yeah.
So, you know, it's, so I worry about her.
We're getting toward the end.
Okay.
How has it been for you?
It's been difficult, but
Yeah.
not horrible.
Well, that's good. You can bear it.
It's, yeah.
It is difficult, therapy. It's really difficult getting
Yeah.
into this
Yeah.
painful stuff.
I remember a friend of mine told me her therapist told her it's like surgery without anesthesia.
Yeah.
And that when he was telling her to be ready to.
There's
Yeah.
comfort in it too, but it's
Yes,
painful.
yes, yes. Well, I think there's comfort always in talking to
Yeah.
someone.
Is there anything you want to ask me or?
I guess my question would be whether you think that I am ready for that kind of therapy, or if I'm too kind of unwilling to take those
Oh,
steps.
it's a good question because you can feel in yourself both sides of that very strongly, right?
Right, right.
I think you can do it, and I think it would be greatly worth it to you to do it. I think you should be very careful to interview several therapists. And
I did that before, actually.
Be sure you get a person that you really trust
Right.
and that you really trust to hang in with you,
Yeah, yeah,
because that will tilt the balance
yeah.
toward your being able to fight the part of you that wants to just say, "Ah, the hell with this.
Right.
I'm out of here.
Right.
This isn't working like everything else isn't working."
Right.
And
Right.
that is pretty predictable that could come up. But it will be painful, but I think you'll find it healing. And I think you'll be able to make changes, but it's not going to be real fast.
Right, right.
Does that
Right.
feel right to you?
Yeah, yeah, yeah. I would like it to be overnight.
Of
but,
course.
But I'm sure everybody does. But,
Yeah.
but
Okay, well
All
then I
right.
guess we'll stop there.
okay, all right then.
It was a pleasure
It
meeting
was
you.
so nice meeting you. Thank you so much.
You're very welcome.